everybody, welcome to the Healthy SBC Podcast. I'm your host, Jeremy Sutton. I'm here with Dr. Ghattas from Gladiator Men's Health, and we're going to be talking about his practice and why he got into medicine and how he's serving men here in the Shreveport-Bossier City community. So, Dr. Ghattas, thank you so much for being on the podcast.
Thank you for coming in. I really appreciate it.
Yeah, I'm excited to talk to you. So, let's just, introduce yourself to the audience, why you got into medicine, that kind of thing.
Okay, so my name is Tharwat Ghattas. I am double board certified. I'm certified in internal medicine and oncology. I went to medical school in 1999 for all the wrong reason, to be honest with you. My dad wanted me to go to medical school. I hated the first 2 years so much to the point that I was about to quit. But then, because that was mainly academic stuff like biochemistry and histology and all of that, and I really didn't like it. But once I got to the clinical stuff in third and fourth years of medical school, I really loved it. I loved serving my patient. And it's kind of funny you ask that question, because I was just with my friend yesterday, and we were talking about like the meaning of life and all of that, and he made me think about, like, he was asking, why do you wake up every morning? And
right.
And I really love what I do. I wake up every morning to serve, basically. That's what I love to do. I love to go see patients, take care of them, spend time to figure out what's happening, spend time to change their life, change their quality of life. And that's how I wake up every morning.
Love it. Yeah, I love that. So my very first podcast I had years ago was called the Servant PT Podcast, because I heard this guy talk about servant leadership. He was the former CEO of Tyson Foods.
Oh, yeah.
He gave like 10 tenets of servant leadership. And I said, that's what I want to do, because that's how we should be leading people and serving.
Right.
So I really resonated with that. And the first thing you said is, I hated every second of the first year of PT school.
Yes.
And I would call my dad. I was in Florida. He was here in Louisiana. I would say, I think I'm going to do something different. And so finally one day he said, either stop calling me or just come home. Like, I'm sick of talking to you about this. Yeah. Either do it or come home. But same thing, when I got out in the community and started doing the work, I loved it. And I love serving people. So I'm super happy to hear that. We'll talk about why you started Gladiator Men's Health and why you're serving men here in Shreveport-Bossier.
Well, it circled back to the same idea. Like, you want to serve men, and you want to provide a service that really doesn't exist in Shreveport and Bossier. Look at all the wellness clinics in town. Look at all the weight loss clinic in town. Look at all of those. It's mainly directed to a certain population, which is middle-aged women, and there's nothing wrong with that. I'm not saying that there's something wrong with that, but there is no clinic in the northwest of Louisiana that serve middle-aged men.
Right.
Comprehensively. So a 40-year-old man that is overweight and struggling with energy, struggling with sexual health, struggling with hair loss, to achieve some results, he has to go to multiple places, which have a different service model, which not comprehensive. So what if we can have a clinic that can provide all of that in one place in a comprehensive, but also it's led by an oncologist. So it's led by somebody that spent the last 4 years of my life to do everything in evidence-based approach. Not haphazard, not to come here and we'll give you 200 milligrams of testosterone, go build some muscles. No, you're gonna come here, we're gonna look at what your needs are, how to approach that scientifically, and prevent harm and give you a quality of life. Right. That was the goal of this.
Yeah, I love that. And I interviewed my brain's, we talked about this earlier. I can't bring it to my brain now. Right. I talk to him. But his name's Bob, and they own one of the IV places in town. They just opened one up right here on Chinaberry in Bossier. and he was talking about how, our IV center is not like a lot of places where you just come in. We've kind of trained somebody or whatever. He said we have RNs, we have this hood that keeps it from being contaminated, and this is all medical based research. We're not just saying, hey, come get this cocktail that feels good, and then injecting stuff and we don't really know. So I love that science-based, evidence-based thing you're talking about. And when I first saw, I think Facebook targeted me with an ad or something for your clinic, and I saw, because I'm middle-aged, bald, overweight male, and I was like, okay, I'm going to check this guy out. And then I saw, hey, yeah, he's an oncologist. Like, you're highly trained.
Yeah.
So I love that. Was this was your first hope for this clinic? Like, let's just serve men and let's create something that's not here, right?
Yes, that was the whole goal, and it took a few months to develop the protocols and get everything here. Also, we provide services that we're the leading in, for example, in sexual health, we have the gain wave machine that really works for two ways. You either can use it to enhance performance, or you use it to improve disease or treat disease.
Right.
And we were forward thinking before everybody in town to get this machine in, and we also do stuff like PRP injections for hair and PRP injection for erectile function. I just got a call yesterday from somebody from down south, about 300 miles, 200 miles, more than 150 miles down south. He heard about our clinic because nobody else does a PRP injection for erectile function in a 200-mile radius.
Right.
So we're not only trying to be, we're trying to be leaders for these services here in town.
Yeah, and I mean that's something that's really important to me, and it's important to everybody, right?
Yeah, absolutely.
If as a man, if I can't perform sexually, I mean, that's pretty much a huge.
Yeah, it's an identity issue.
Yeah, absolutely.
For men, sex, there's a lot of it is tied to identity.
Right.
And if you look at the statistic, it's crazy and it's scary, because look at this: one out of 3 men have erectile dysfunction, some degree of erectile dysfunction, and 1 out of 3 men have problems with ejaculatory function, like they don't last long, the endurance is not there.
Right.
So you have 2/3 of the men have problems, but men don't talk about it.
Right.
So, because imagine a man go to a wellness center and it's going to be really difficult for them to open up to this.
Yeah, absolutely.
So we're trying to provide like a safe, private areas that you can come in and open up for this.
Yeah, and I think you've done a great job of that, because y'all's location is really convenient off of Benton and Shed.
Yeah.
And then it's a kind of a quiet location. I know we just heard a loud motorcycle or whatever, but it's a very quiet and nice location where you are. So immediately when you start talking about what you're doing, I'm thinking, okay, well, I want to come here, and and you could come here, it would be great. And it's funny, men, we can't even talk about mental health, so we're definitely not talking about erectile dysfunction.
No, I mean, how many of your friends can tell you, oh man, I have a problem with erectile function? I mean, no, even with your friends, like your best friend wouldn't come and talk with you and say, I have erectile dysfunction.
Right.
I couldn't do it, or I did it too fast. The endurance is not there.
Right.
So like, we need to break the stigma, and we need to provide them in a place they can come in, and it's evidence-based, it's a private, it's discreet, it's professional, and it's a safe place.
Right.
So that's the whole goal of this. We did compounding medicine. I personally created this medicine to treat erectile function and treat ejaculatory dysfunction, like premature ejaculation, or even if you want to improve the performance. So if somebody have sex for 2 minutes or 3 minutes, what if we can improve the performance to 7-10 minutes, 15 minutes? but also that's a way to improve quality of life.
Sure, relationships.
If relationship, the wife is happy, the girlfriend is happy, you have a boost of confidence and all of that.
Right.
So that's what we have here, and nobody else has that. Nobody else think of that. How many times you go to a man go to the doctor and it's like, okay, I do for 3 minutes. Do you have anything for me to last for 15 minutes? I mean, no, it doesn't. It doesn't come in a conversation.
Right. Yeah.
I mean, they're not gonna open up for that.
Absolutely not. You know, as a PT, I've seen a ton of people over the years with chronic low back pain, and one of the things we want to check for is called Aquinas syndrome. And so I ask people if they're bowel or bladder incontinent, and a lot of times they'll say no, and then maybe a week later they'll say, hey, I've been having this issue. And I'm like, yeah, well, I asked you about that on the first visit. Well, I know I was embarrassed to say. And so it is. And so then sexual health is even more.
It's more.
And I think there's, in PT world, I see a ton of women treating women's health, and that's getting better and less of a stigma. But men's, we're not. We're not even close.
We're not close. We have to, you have to provide them with the place first. And there was no place for a man to come and talk about all of that without judgment. And
now you created it.
And now we created that place.
That's amazing. So talk about the other things you do. I know sexual health, but what else are you doing for men to help them?
So one of our main services is weight loss. Mm-hmm. So we provide all the GLP medicine, like tirzepatide, semaglutide. They call it the magic shot. I don't know. It's like there's a drug in the streets, so we call it the magic shot. So we have a long experience with that medicine with our other clinic, Shedid, which is across just next door. I mean, I think we have about 55,000 pound loss in Shedid over the last 2 years. So the average patient lose about 15 pounds, and most of our patients lose about 10 to 12 pounds in the first months.
It's amazing.
And we were the first clinic in town to use these medicine in 2022. So medically, we have built this experience over 2 years. And if you see 4,000 patients over 2 years, you know how to do it.
Right, absolutely.
And we have the data that to go through, like we follow these data. So experience-wise, this is the best place because we have this data. We have been doing this for long time. We have 2 patients so far, not 2 patients total, 2 patients was the best experience we found so far. We have a patient that lost 36 pounds in 3 months, and another patient lost 25 pounds over the last 2 months. So it works.
Right.
Maybe that's why they call it magic shot, but it works, and that's one of our services here. The other service that is very unique to us is a hair restoration service. So most middle-aged men, they start losing hair around the age of 30. So in the hair restoration therapy, we have 2 approaches because both of them complement each other. The first approach is we do a DNA test through the saliva. Mm-hmm. And the tests take about 2 weeks to come in. So we send the kit with you home. You do the test, you send it back to the lab. The lab sends me a report and say, okay, Jeremy is gonna respond to these 3 medicine. Mm-hmm. And it gives you an exact percentage on how much he's gonna respond to each medicine.
Right.
So I go to a compound pharmacy and say, hey, I need these 3 medicine in one topical foam or gel for Jeremy, and that you go pick it up and start using. But also we use the PRP injections through the hair, which is basically you take blood sample, you centrifuge it, get the platelet and proteins and growth factor, you inject it back in the scalp. We have a couple of patients already doing this now, and the results are amazing.
Awesome.
But it comes back to evidence-based, comprehensive, complementary to each other with rock solid science.
Love it. I love that. I love that you're really tell them how much that the science is and it's evidence-based, because we want that in medicine.
Yeah, and the last service that is gonna prove your point is the low testosterone service.
Mm-hmm.
So one of my biggest concern about this service in Shreveport is because I saw it all the time as a hospital medicine and as an oncologist. The problem with low T in Shreveport and Bossier is most of them, they get it from inexperienced people or just random place somewhere, and it is difficult to handle hormones. There is a reason it's so complicated. There is like a whole subspecialty for that.
Right.
And just you come in and okay, here is a shot of testosterone, 200 milligrams this month. It's just, you give them red blood cell counts go up, hemoglobin go up, and you give them strokes and prostate cancer. If you don't do it right and if you don't do it evidence-based, you will cause harm. And that's why we have a very strict protocol. If you want to check on your testosterone, we send a battery of labs. I think it's at least 10 of them, and we look for everything before we even consider replacing it. And once we get the labs, then we decide, we start with the lowest effective dose, and follow up 6 weeks later, follow up 3 months later, follow up every month with hemoglobin. You're trying to prevent stroke, you're trying to prevent prostate cancer. You want to give them good quality of life, but at the same time, you want to make sure that over 10 years, they don't end up with prostate cancer and a stroke.
Right.
So
pretty important.
Yes. So that's why our logo is rock solid science, because we want to make sure that we are the most evidence-based clinic and not just random stuff.
Yeah, I love that. So I like to do what I call it SBC Spotlight, where you just say again, where you're located, how people contact you, and things like that.
Okay, so we're located in 2211 Shade Road, Bossier City, Suite A. Our website is gladiatormenshealth.com. You can easily find us on Google. Once you just put Gladiator Men's Health, it shows up right away. Our website is very informative, and you can book your appointments through the website straight. I mean, it's very simple. You just fill the form. Our receptionist is gonna call you, get the lab put in, and we see you within a week. And I want to talk about the process, how this works. So once you submit the form or you call in, then we create a file for you. We send all the lab requests to the lab. We would like first for you to do the lab before you come in, so your first visit is just not waste of time for you. By the time you come in to the first visit, the labs are in, so we know what exactly we want to approach. When you come in, we'll get you to the 3D Fit 3D scanner in the next door here. And I wanted to tell you that we were the first clinic in town that we had Fit 3D scanner. Everybody after that start imitating us.
Yeah.
I think that's the best compliment.
That's right.
So you go and the Fit 3D scan, we do the scan, we check your weight, your basal metabolic rate, your fat percentage, your protein percentage, and now we have your labs, you have your Fit 3D scan. Now we sit down, figure out what your needs are, and based on all of that, we formulate a plan and we go for it.
Awesome, I love that. So everything's comprehensive. You come in, you're looking at their labs. They're not just here to meet you.
Yeah.
I like that, because I don't want to go to a doctor's appointment or any appointment and just sit there and talk about what my goals are without having some input from you or
by the time you sit in that chair there, we already have your labs. We already have your fit 3D scan. We already knows what you want to do. Then it's time to be very fruitful discussion on what you want to achieve, and we'll go from there.
Yeah, awesome. I love that. So I'd like to give the last minute. You can talk about whatever you want. If there's something else we didn't cover and you want to address it or whatever, then we'll be done.
What else you want to cover?
I think the cancer screening. You don't know speak about the cancer screening.
Yeah. I mean, part of our services too is the gallery cancer screening. It's a test, that's a blood test that you do. It covers about a screen for about 50 cancer. You know, if you think about it, 1 in 3 will have cancer in their lifetime. So we only have about 5 cancers that actually has approved the screening, and you have about 198 type of cancers out there. So the only way to prevent massive disadvantage with the fight of cancer is to detect it early.
Right.
So if you can detect it early, that's the benefit of it, and Gallery provides that to our patient.
So that's 50 different cancer screenings.
Mm-hmm.
Yeah, it's amazing. I think one of their concierge medicine told me about that, but not many people are doing that. So
yeah, one of the barriers is the price.
Mm-hmm.
But if you can afford it, I think it's totally worth it. Irina and I are doing it.
Yeah, absolutely. Awesome. Dr. Ghattas, thank you so much for being on the podcast. I appreciate it.
I appreciate you, man. Thank you for coming.